My name is Vijay Ramanujam. I'm the CIO. I'm the CIO for DHHS. I've been with DHHS for the last 6 years. As a matter of fact, probably 2 days ago, I reached the 6 years milestone. Yay, I survived. Um, I came from private sector, like many people here, or maybe not many people. I often get these like, you're only 6 years old. There are people here 25, 30 years. What are you talking about, right? I mean, I appreciate the services that they provide and the consistency and being with the state for such a long time, right? Those are all important services that you all do and we all do here collectively. So thank you for all of that. When I joined from private to public sector, I was wondering how state government will work. We're going to talk about some of the tools and technologies, what's the adoption, how quickly decisions can be made, and all of that, right? So a lot of those things were going in mind beyond what am I going to get paid, right? So there's that piece of it, right? But I think it was a very good decision I made along the way to join DHHS and be part of the public service in the space. Um, in Within DHHS, we have it's a large agency, as you all can imagine. We have many business divisions, around 33 some business divisions. I may be off on the numbers, maybe 14,000, 15,000 employees, contractors. So it's a large agency, right? And how do these people all work together, which is where I'm going to talk about some of the key topics in the space. And I'll honestly admit my handwriting is the worst handwriting. Okay. And I cannot even read my own writing when I start scribbling there. And a lot of people here can attest to it, especially the DHHS folks, right? Um, and the reason I'm saying that is that I'm going back in time here, probably in 1990s or late 80s, right? I'm that old. You can see the gray hair and balding and everything happening there. Back then, you had to write everything, right? There was not an electronic system. There was not tools and technologies. There was not even a computer where it came from, right? It was still in early stages of that. But we're right about the time when I was about to get into college, I started seeing these computers there, right? And I'm like, oh, I think this is my way out of my bad handwriting. I can start typing things now, right? Nobody will know how I write, but everybody will understand what I'm writing. And that was my first step in the digital type of journey, right? I think Microsoft Word and other tools were still in early stages by itself, but I could type anything and then I could do that. And then came the email revolution, right? Where I don't have to send any more letters. Again, my writing is bad. Um, and how do I write letters to anybody, right? So then came the email, and then we started using email a lot in terms of communication. So my adoption or understanding of digital tools started way back when, right? And everybody would have had their own journey, right? Then the internet came, then it kind of opened up all kinds of tools and things that you could do by yourself. In my mind, we always talk about people, process, and technology. I think most of everybody would be familiar with those terms, right? Everything we do has those three components: people, process, and technology. I call it as talent, process, and technology. And the reason why I'm introducing the term talent is based on people's skills and people's ability to do things and people's ability to be productive and being able to learn and adapt as part of their skills and learning aspects of it, right? So that's a talent piece of it that we all sit here and then we are learning every day some new tools and new technologies there. The other part of it is the process, right? We always like process. We like governances. We like decision-making process, and not everything takes that quickly to make decisions there, right? So we all go through that process, right? And process could mean governances. Process could mean like how do we make decisions and what type of tools and technologies that we should use as part of our day-to-day work here. And those are decision making process. Technology, right? There is a lot of technology here that is available nowadays, right? You can almost go and get any technology that you want. but don't go and get unlicensed version in your ecosystem. That's a very, very bad idea. Don't ever do that. I think we have DRT and even in DHHS, we have some great tools and technologies to quickly detect it and disable it. So don't be offended if it gets disabled also, right? So think about what type of technologies we have. You go through the governance process, you kind of bring the talent and upskill them in the space, and eventually they kind of start adopting those tools there, right? So that's the technology aspect of it. So people, right? The talent aspect of it. When you look at talent, especially in the agency of our size, we have unique skill sets. We have blended skill sets. We have people who are curious to do a lot of things new on their own. And we want to make sure that we are enabling them, right? When we get there, in terms of enabling people, I'm a big proponent. I always tell my team that are there things that people can do on their own, right? I don't need um, an IT team to do everything for them, right? There are many things that they could do self-service on their own, so they don't need to rely on other teams to do that. So I'm a big proponent of enabling other people and other divisions and other technologies for people who are not part of IT, right? So it is very important for us to enable them. And there's a lot of visual tools and everything. Now AI comes along, and AI has its own journey, and we'll never have a conversation without AI, right? So AI is another critical component piece of it. When so for all of these, right, we have to train our staff to do a lot of these things. I'm thinking almost everybody uses Teams in some fashion. Is that fair, right? But most of you might be using Teams maybe for meetings, right? And maybe for sending messages. Did anybody know that in Teams, it's not always instant messages. You can also send asynchronous messages. For example, you can send a message, like I think most of you should be aware in emails, in Outlook, you can send an email and delay sending that email. Most of you use that feature, unless you want to show that you worked at 4 a.m. or 3 a.m. in the morning, like I do, right? If you want to showcase to your boss, like, hey, I sent this email at 4 a.m. I've been working very hard in that space, right? Um, but even in email, you can go and delay that sending of that email at some point, right? So you have that feature. You have the same thing in Teams. You can delay sending the message if you want to, based on send it at 8 a.m. or 7:30 a.m. You can do that. Go and try that out one day, right? And the reason I'm saying that is that that's a very powerful tool. And what I tell my team is that, hey, I might be working at odd hours, you might be working odd hours, but even if I send you a message at 7 p.m. or 4 a.m., right, I can delay sending that. Or if I choose to send it, it's an asynchronous. You don't need to wake up in the morning because a lot of people have their phone close, right? When I go home, I unwind, I keep my phone the opposite way. So I'm not looking at the phone. And I keep it a little further away from me so I don't keep grabbing to it, right? So I'll be lazy enough to get up and grab that phone from there. So I use those type of techniques too. But I tell my team that, hey, I might be sending messages. You do not need to respond to it. If I need you to respond to it, I am going to call you, right? So there are ways to communicate and all of that. But you have those different features in tools like Teams. Has anybody used polls feature in Teams? And I'm not talking about just Microsoft product, but go ahead. I see a few hands raised, right? When you're in a meeting, you can do anonymous polls. There's a poll feature where you want to get a decision on from everybody. You can make it anonymous, you can make it personalized, and so you know who did it. But most of the time, polls are done anonymous because some people don't want to know other people to know what decisions that they make, right? Especially on some critical meetings. So you can use the poll feature in Teams, right? You could also do many other things in Teams. Has anybody gone, when you look at the Teams app, most of us either go to channels or we go to Teams, right? To message, right? Has anybody seen I think it's called as Viva or Viva Connections. How would you pronounce that, right? On the top left, you will see Viva Connections. Now that's your landing page that's sitting there, right? When you open up Teams. In that, you have variety of tools and technologies available that kind of gives you in a dashboard, and you can go there. You can go to Fiori to enter your time from there. You can go and add other apps. Like for example, the other day I think it's Clip something, Clip Champ or something. When you look at the Teams app, you press the dot, 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 three dots, right? You go there and you'll see a Clip Champ there, and it says that you can screen record, right? You can do that piece of it also, right? If you want to. We all go into the mode of meetings where we no longer take notes, right? Again, I don't take notes. I process information in a different way. As you can see, I'm not having any presentation. I told when Ash and others reached out to me, can we talk about it? I said, I'm not doing any presentation because I'm not a big fan of that. So I kind of digest information and deliver information in a different way. Um, when you go to meeting, right? You don't. I think most of you would be using it. You obviously get consent from the meeting participants that it's okay to record it, right? It's a very powerful device. What we all do as a state is all public information, right? Unless you flag it as legal, confidential, whatever it is, right? I see some legal people also here. Um, Other than that, you can record those conversations, and then you can also transcribe it. You don't need to record it. You can also do the transcribing. So you don't have to go back in time and help make decisions. We have used those tools very effectively in DHHS, where not every meeting we record. We just have regular meetings also, and we don't need to do all of that. But when we do that, we go back in time or like on historical decisions. Hey, can you send me that recording? And we can go to this particular point. It even tells you nowadays that when did you speak or when did somebody call your name at what minute of that recording? So you don't have to grudgingly listen to that whole 45-minute video. You can scroll down or it will tell you where you were referred to or where you made a point or a decision, right? So use those tools effectively. There's a lot of things that you could use in Teams. As you walk out today, or even while you're here, check on the phone, right? That you can try out all of these features that are going to be very important for you to be productive day in, day out. So that's enough about Teams, right? Let's talk about, we'll switch over here. Let's talk about other types of tools and technologies. We at DHHS, as I said, we are a large agency and there are different needs at DHHS. For example, there are many digital tools that our division of hard and hearing or division for the services and blind, they use these tools to do a variety of things, right? I think most of you would have heard about Braille, right? But you can also combine Braille and voice. We have some some tool called as CARTS. Don't ask me what all it stands for, but it's called a CARTS. But that kind of combines Braille and voice recording, depending on how you're accessing information and how you're able to listen to those things, right? That's a critical tool that helps people in those divisions to be able to understand and digest information there, right? So that's a great process there. We get into, and it's not all about DHHS. I know that DIT, I want to speak about DIT too, right? I know Ash and his team, going back to the process, they do a lot of governance. So there is an M365 governance meeting, specifically on M365 tools, right? Things that are being done in M365 tenant, what are some things that are coming in new there, that we get a lot of wealth of information. And what his team does is that they kind of communicate that on a very periodic basis to all the agency leadership, as well as the individual teams there, right? So people understand what are the other things that are coming up in M365. So that's a governance piece of it, right? On the DHHS side, we also love governances. We do a lot of governances and committees and everything to get to a point of decisions, right? I do not know how many governances we have, but we try to trim it down as much as possible to help make decisions, right? But we do have something called as, like any agency, as part of the AI piece of it, we have several governances in terms of what type of AI technologies, what type of tools that we can use to help enable our workforce to do their best work, right? So those governances, we run on we started doing a lot of those actual council meetings where we are kind of getting use cases. I was even forced to come and present my own AI use cases to my own AI council, right? But that's the way we operate. Like it doesn't matter where you're sitting in the organization, that you have an idea and then you want to get an approval. You go through that AI council to make that decisions. But AI has opened up a lot of options for all of us. I think almost everybody knows about ChatGPT. Everybody is learning about Gemini. Everybody has started using Microsoft Copilot, right? The license and the non and the Copilot chat versions. Those are all very critical tools. And the way we look at it is that we we do not we always advise the people who are putting use cases there, don't put a use case just because you want to use AI, right? Put a use put the use case and we will figure out collectively whether AI is the right way to go about it. Sometimes AI is not the right way to go about it. We have had many instances where people come up with ideas just to use AI, right? So we kind of gravitate in that space in terms of council and decision making process there. So in again, we're hoping one day DRT will get us all the enterprise level licenses um, for your chat GPTs and your Gemini and everything. I know they're working very hard, but those things take a long time. But I think we are very excited that that will happen at some point soon, so we can start rolling that out to across the board, right? Some of the tools and technologies, they're just simply not affordable, depending on the size of the agency or the size of the division within the agency, right? I know there might be some Microsoft people here, and I've always told them this too, that, hey, Microsoft Copilot is a little expensive per user, per license, based on our employee strength. If I want to roll it out to all of DHHS, that's going to cost me probably 6.2 or $6.3 million per year, right? We don't have the money to do those type of things, but we also want to enable our workforce to do that work. So obviously the cost is a big factor that kind of gets evaluated on what we can and what we cannot do there. So I think that's how we are kind of using AI in many spaces and technology decisions. We also, while this is not functional, we also are working on tools and platform type of governance, right? Which includes some of these tools that are going to make it productive for people to do their work. What I I think most of you here may have some teenager, niece, nephew, son, daughter, whatever it might be, right? Whoever it might be. You also have this FOMO, right? Fear of missing out. I'm sure everybody must have heard about it, right? Oh, everybody is learning this cool technology and tool. I'm going to be left out. I need to learn that too, right? I think that's a good thing in some cases. It's also not a great thing. If you keep FOMOing too many times, right? Then you kind of digress into the space of like, I need to learn this. I need to get 25 certifications today so that I can be the best and I know everything type of thing. You don't need to do all of that. I personally kind of continue to learn along the way. I am not an expert in everything. That's why I have a team where I consult with them to get the right level of expertise and decision. They often sometimes tell me that, hey, this is wrong, and I don't think we should do it. But I kind of take it in a way and listen to it and then make the right decisions, right? So don't worry about the FOMO piece of it. Don't feel you are left behind in AI space. You still, if you want to continue to learn things, you should definitely continue to learn. I'm not saying don't learn things on your own, but you should do that. But but don't feel that you're going to be left out. There's always a way to learn and digress there, and nowadays all kinds of technologies and tools can help you with that. We we last year, I think it's 1 year again for that, we implemented something called as electronic health record for all our DSOF facilities, and we use Epic as our platform. And within Epic, there's a lot of digital tools and technologies to help with the physicians, the clinicians, right? How do they kind of take care of our residents in all our state-operated health facilities? So that was a huge footprint of new technology from where we moved from paper to electronic for the most part, right? And we built a lot of workflows using the technology and platform. So I think that gives us a more digital tools for our clinicians and nurses to be able to record information as well as to be able to take care of the residents, spend more time on the residents rather than spending more time on learning and trying to navigate through the technology, right? I've seen some of the workflows in the past where the workflows was like you go into a closet space where there's a lot of paper records, and the first person who enters in the morning, they make some. I literally saw this. They make some notes there, and then they fold the top of the paper this way. So that means that the next person can come and do their work, right? So that's how the workflows were there in some of these places. Now they have a lot of digital tools and technologies to take care of that they don't have to worry about all of that. So the more enablement that we do in the space to help our people there. Not sure what time is it, but how much time I have, but I'll keep going unless Ash says like I have to stop. Okay. um, from so we talked about process, we talked about tools, we talked about technologies and all of that. There are things like we also use this. There's a cool tool called a scribe. I think it kind of scribes it for you that is used in social services spaces in some cases that they use that a lot to do the day-to-day work. We also are on the pathway to introduce. We're already doing that now. It's called as mobility, right? And I'm talking about the child welfare space of DHHS. uh, if you all do not know this, we have 100 counties, right? And we have to provide technology and tools for our social welfare workers in all the county DSS's office to go to remote locations, right? At the middle of the night, because something is bad is happening in a family, right? And they get called, and then they have to go in a rural area. They have to go and talk to these parents or the children to figure out what is happening to take care of the family or the child, right? The well-being there. So when you go to some of these remote locations, I know North Carolina, we are doing a lot of broadband initiatives. I know Secretary Denny in his previous role, even in his current role, I think they're promoting a lot of digital footprint or broadband footprint across the state. But in some places, we just don't have the internet connection. So what we did was that we kind of worked with the counties to figure out how we can give them mobility access. Like it is offline gathering of information using the tools and technologies we have. So I go visit a home and I go kind of intake the situation that is happening there, right? And I kind of take the case notes and everything. They don't have to have internet to connect to the particular digital tool or process or technology there, right? So they simply go to our platform and then they go and enter that information and they come out. They kind of go and when the internet connection is there or wherever they're connected, it automatically goes and syncs up into the actual technology. That's what we're talking about. In the past, what used to happen was that they always carry notebook. People like to write, unlike me, right? So they go and write all these case notes, and then they will come back and spend the time typing all of that information back into the system, right? We don't need to do many of that, right? So I think that's a huge transformation for them that they don't have to worry about spending more time interacting with the technology, but rather spend more time interacting with the children and families to take care of them. So those are all powerful ways of how we continue to enable our people. Has anybody heard about the role called as business technologist, right? It's a blend of, it's nothing, but it's a blend of somebody who's sitting in the business, but they also can do technology things, right? And it's based on enablement, right? Um, we, I think where most of them are is that nowadays we want to make sure that our business folks who are not IT people can go and build their own dashboards or their own visuals in terms of what they want to look at from a data perspective or summarization perspective, right? That's a huge thing for them. And it is important that they are able to function in their own way rather than relying on always technology team to do everything. We love technology. I am part of the technology. I'm not trying to say that technology does not need to be there or IT team does not need to be there. IT team exists for a lot of these things to enable a lot of these business folks to be able to do their best work there. So we have, I think, within DHHS, and I don't know all the numbers there, but we have sent a lot of business people to training to build dashboards on their own, right? And then a lot of people are building dashboards on their own. You want to take it to the next step, right? Bring back AI. What I'm pushing our team in a couple of initiatives is to go and start doing conversational analytics, right? Or conversational AI using natural language, right? Tell me how many people got immunized today. Tell me how many people, how many kids or children were born today, and how many children who were born today also were immunized, right? So if you, because we have a lot of data there, and our goal and our secretary or chief deputy, deputy secretaries, all the leadership, and including the program level staff in the individual divisions, they they don't need to create custom reports every time to do all of that, build some quick queries to do all of that. You can put your own natural language using the tools that we have to be able to build all of that. We're not there yet. I think that is a vision, and that's where we are pushing, 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 and I think we'll get there soon in terms of how we kind of interact with many data points that we have there. What else is going on? I think with DIT, we have had a lot of collaboration activities. Even this event, when Ash and Karen asked me like, "Hey, can you come and speak?" Like, why am I coming and speaking to this event? Well, I think in DHHS we have a lot of things that are going on there. So can you share some of that experience, and as well as from a broader state government ecosystem, right? Um, and and I appreciate the opportunity to talk about some of these things. But we we do a lot of collaboration with multiple agencies, right? I think I learn a lot in the monthly CIO meeting where different agencies, small or big or big, they talk about what they may have done recently or what they believe is working or not working. And we kind of share those type of things within our council or within our CIO kind of groups there. And then we kind of start trickling down that information using variety of tools and technologies there. So so the collaboration and talking to each other is great. We want to make sure that we are using the right tools and technologies to help with that. If anybody has any idea, as long as it is available through the state procurement vehicle or an individual procurement vehicle, then I think it's easier to get those type of tools and technologies there to help us get there eventually. So in the way I've seen, if you take Outlook or even Microsoft Word, for example, right? First time we started using it, I'm talking about the evolution of all of this, right? We all can relate to that. I can type things and I can put it in my own sentences and words and everything. And then they introduce spell check, right? Spell check is a feature, right? These are all simple things, right? So spell check came along and it told us like, how do I kind of, am I spelling it right, right? And I often spell bad. And then came along grammar check, right? So then they introduced grammar at that point. Now we have tone check. Are you writing with the right tone? Are you going to offend somebody, right? Are you saying the right words? Is the person who is reading it is happy or not happy, right? If you go to Microsoft Copilot or any tool like Grammarly or ChatGPT or any of those things, right? It will tell you that, hey, you are really sucking at this. Don't say it this way. It does tell you, right? And one of the we all write emails in anger sometimes. We write communications when we are unhappy. We also write communications when we are happy. But the first two situations, right? Never ever do do that, right? These tools are now working with you because in the past, right, when we didn't have these tools, we used to write something and we'll send it to our boss, or we may not even send it to our boss, we'll simply send it over, right? And then people are going to be really ugly and unhappy, and then they're going to complain and whine to everybody under the sun, right? But now we can use these tools as another addition, like another human being, to be able to do your job better and to be make it more professional, right? I use that a lot, right? Way back when, as I was kind of growing up in my career, um, I was angry why this person is making this decision. Okay, I'm going to say I don't like this decision, right? Something as simple as that, or I don't agree with that. But you have a tone in that conversation, right? And then over a period of time, like, okay, I should not write it this way. Maybe I should write it this way and talk about it this way, right? So, but I use these tools, and you all should use based on what you have in your ecosystem to be able to communicate better with a more positive tone there. While you may be angry, I always tell people if you're angry, come talk to me. I do a lot of therapy sessions for a lot of my team members. Uh, they come to me. I'm not a licensed therapist or anything, uh, but sometimes you just have to mellow down, calm down, and let's talk about it. And you don't need to send emails at late night just to prove a point. You don't need to send an email right when it comes. My kids, like we all have different levels of a digital footprint and kids. I'm not in any social media. The only place I'm in is in LinkedIn. Obviously, we all use text, right? When my kid or when my daughters text me, sometimes they say like, "You left me unread." Okay. I'm sure you all can relate to it, right? I'm like, do I have to respond to everything that that you're telling me? Can I hold on? Can I wait? And do I need? Can I do something else and then come back to you, right? So you don't have to do certain things. You have these tools and technologies to help you process and help you guide your day-to-day things, right? Those are some key points that I thought I should talk about. I'm almost out of time here. Approvals, right? How many of you use DocuSign or Adobe Sign here? How did we used to do before? You chase somebody down, or you keep walking behind them until the parking lot and get their signature, right? And it's always the last minute, right? It's never on time type of thing, right? And or we send it via emails, then 25 people, of which only 5 people need to respond, 25 people respond. Now suddenly I have 25 emails to read whether you're approving it or not approving it, right? DocuSign, features from DocuSign and features from Adobe Sign. It kind of builds a workflow, and it's a digital product in my mind where we go and do this electronically, right? You still have to tap on to people. Hey, have you read this DocuSign email? Can you approve it right now? We still do that every now and then, but that's okay. But at least you have an electronic footprint to do a lot of that work. So that's a great tool in my mind that we all need to be able to use there. I think I'm almost out of time there. What I would advise is that try things, try new things, keep trying, keep asking questions, and don't be left out, and talk to people to get the right help there. Right. Last thing, I started using this for the last many months now. Be well, be proud, be nice to each other. Yeah. That's all I have. Thank you all.